Hi, I'm Chandra Price, the founder of the Medicare Teachers Insurance Agency. We are a national agency and we have representatives in multiple states, but we do not work for the federal government. We do not work for Medicare. We are just independent brokers. Today, we wanted to talk a little bit more about Medicare supplements so that you can understand your options and the timing for when you might enroll into a Medicare supplement. For Medicare supplements, if you recall, another term for Medicare supplement is Medigap. Those two terms are used interchangeably. So for our purposes right now, we're going to choose to talk about Medicare supplements, but those I could say Medigap and that's the same. Now, when you are choosing your Medicare supplement plan, when you are turning 65, you have 6 months from the time you turn 65 and you are enrolled in Part B, as in boy, of Medicare, to choose your Medigap. I just said Medigap. See, Medicare supplement, Medigap, interchangeable. So you have those first 6 months after you turn 65 and you turn on your Part B to enroll yourself into a Medicare supplement plan. And that is called open enrollment. During your open enrollment period, you can choose any Medigap policy that's available to you in your area, and the insurance company cannot deny you. They have to give it to you, and they have to give it to you at the rates for anybody who's turning 65. There's no looking at your medical history or any current conditions that you might have. You get what you want. So that's a great time to choose your Medicare supplement policy because there's no questions asked from anybody. If you want a supplement, you get the supplement. So that's a great time. Now, there can be exceptions to all of this. It can vary by state. So if there are different state regulations on this, that other opportunities in your particular state, we're happy to talk about what might be available to you. These are general rules of thumb. So another time that you could enroll into a Medigap policy is when you have what's called guaranteed issue. And if you take a look at your choosing a Medigap policy, and we have digital versions of that we can email to you if you'd like. But there's several reasons why you would be able to enroll in a plan with guaranteed issue. And just like this name, the name of the issuance, guaranteed issue, you're guaranteed to get the policy that you want. You're guaranteed to get the policy of your choice. Just like an open enrollment, they cannot deny you and they can't charge you more. You're going to get whatever you want. Here's a couple of common reasons why you might enroll in a Medicare supplement plan with guaranteed issue. If you have a Medicare supplement or a Medicare Advantage plan and you move out of your current plan's service area, you have guaranteed issue to enroll in the Medigap policy of your choice. So if you move across the country to go live closer to your grandbabies, or if you want to get down to Arizona or Florida because you want to get away from the cold weather, you would have the opportunity to enroll in a Medicare supplement plan. Another reason why you might have guaranteed issue to enroll in a Medicare supplement plan is if you're working and you have an employer group health plan. When you leave that employer group health plan, you'll get a letter from your HR department showing that you had creditable coverage and that you were enrolled in that plan. And you'll submit that with your application for a guaranteed issue into the Medigap policy of your choice. Trial Right is a special program. If you have a Medicare supplement plan, you say you enrolled in it right when you turn 65, and then you keep hearing about interesting things about Medicare Advantage plans in your area. Trial Right gives you a 12-month opportunity to try out that Medicare Advantage plan and decide, do you like Medicare Advantage? Do you like the benefits that go along with Medicare Advantage and that kind of system and the costs associated with it? If you go off of your Medicare supplement and onto a Medicare Advantage plan and you like it, you can just stay on it. You don't have to do anything. But if any time during those 12 months you decide that you made a mistake and you would like to go back to your Medicare supplement plan, you can exercise your trial right. and you can go back into the exact same Medicare supplement plan you had before and drop the Medicare Advantage plan and re-enroll in a Part D prescription drug plan, and no questions asked. You go straight back to what you had before. So that gives you 12 months to try it. And you can exercise your trial right anytime in those 12 months. So you could try the Medicare Advantage plan for 1 month, 3 months, 4 months, 6 months. Anytime within 12 months, you can go back to what you had. If you wait 12 months and a day, then you would have to go through underwriting. There are underwritten policies also, okay? So if you do not qualify to get into a plan without having to answer any medical questions because it's your open enrollment or you have guaranteed issue or you're using your trial right opportunity, then you can still go into a Medicare supplement plan, but you will have to pass underwriting. And what that means is is a list, and this can vary by company, by the way. Some companies are a little bit more lenient than others when they ask the medical questions and what the standards are for your responses. But you must answer medical questions, and they're going to ask you a whole variety of questions. Do you have you been in the hospital overnight in the past 12 or 24 months? Do you have insulin dependent diabetes with 2 or more complications? Do you have cancer? Have you had an internal cancer in the past 5 years or 10 years? Are you confined to a wheelchair? There's a whole list of things that you'll have to answer, and you must answer those honestly because they'll go back and look through your medical records if you have any claim. And if they find out that you lied, they're going to give you all your money back that you paid to them, but you won't have any of that insurance backdated. All of it will vanish. So make sure that you are honest when you answer those underwriting questions. I've had people up to age, last, I don't know, spring, I enrolled somebody, she was 84 years old, and she passed the underwriting. It's not everybody is going to get denied by underwriting. You can just get it regular issued. They can choose. They can choose to issue it. If they think you're going to be really expensive, they can choose to decline it. Or they can say, oh, we'll take a risk, but you're going to have to pay us more each month. They might charge you a higher rate for the opportunity to purchase that Medicare supplement plan. Sometimes people ask, why can they choose to decline me? Because part of the Affordable Care Act meant that there were no medical questions. Well, this is a supplement plan. This is not your base plan. Your base plan is original Medicare when you have a plan like this. So you have not been denied original Medicare. This is extra on top of that. So that's why these plans can choose, once it's past your open enrollment or guaranteed issue, they can choose to say, no, we think you're going to cost too much money. You're too risky for us. We're going to decline to issue this policy. If you are declined, we should try to apply for through another company, because sometimes, like I said before, sometimes one company will be a little bit more lenient than another company. Say this company will decline you for a certain medication. Maybe this company wants to ask you why you were taking it, and if whatever the condition was is under control now, they'll give it to you. So you do have some options there, but talk to us and we are happy to help you apply for coverage and see what you're eligible for. Thank you so much for watching. We'd love to talk to you.